Hi Kazra, my name's Elia. I'm a pharmacist here at Monash. I spoke to you last time about your blood pressure and you've started some blood pressure medications. How are you going with those?
Yep, I was using losartan and amlodipine, and then my blood pressure dropped from 155/100 to 135/85.
Okay, yeah, that's really good to hear that you've had you drop in your blood pressure. It's not currently at the level that we would hope it to be, but it's really great that it has reduced. Last time you mentioned that you were caring for your father.
Yeah. Unfortunately he's sick. Yeah, recently he has been really sick and I'm not really happy about it. I've been so stressed because I had to do a lot of stuff caring for him. Yeah, I'm worried about him, I'm so stressed.
Yeah, I can imagine that would be quite stressful. Stress is something that can contribute a lot to raising your blood pressure. I think that might be a way, if we can help to control your stress, help you to manage that, that might be a way that we can keep reducing your blood pressure. As you mentioned last time, you don't really want to take any more medication.
No, I think that it's already enough. I don't know if I can manage more medications.
Yeah.
Also have some insomnia,
Yeah, I can imagine that would be really hard to do with. So outside of pharmaceuticals and outside of medications, there are other things that we can suggest and that we can sort of help you to start doing that might help to reduce your blood pressure. One of those would be something like a meditative practice. For example, yoga or Tai Chi, something like that would help with reducing your blood pressure. It would also help with your stress levels as well. Which will help, should help your symptoms of insomnia. The other route that we could take to reduce your blood pressure is dietary.
Right.
Yeah, so we will allow some colleagues of ours to explain those to you further.
Yeah, sure.
At this point in time, if you just want to choose one or the other to focus on, that is definitely fine.
Yep.
But hopefully we can give you a bit more of a holistic healthcare approach.
Thank you very much. I'll really consider that. Thank you.
No worries. Thank you. It's often thought that a pharmacist's role has to just stick to medications and making sure that medications are used correctly. And that is definitely a big part of the job. However, we are healthcare professionals that have a large wealth of knowledge available to us about a variety of different health practices. So, in regards to our patient today, we've recommended some non-medicine based interventions to help. And the way that a pharmacist can maintain involvement in that is scheduling regular check-ins with these patients, which is easy to do if they are regular patients of your pharmacy. Otherwise, you'd see them probably on a monthly basis at least when they come in for their medications that are usually a month's supply. So, with this patient that we have on hand, we've recommended a potential couple different routes to go down. So now it's your time to decide as the audience. Put yourself in the shoes of a 58-year-old man who has started some medications and they're helping his blood pressure but not really getting his blood pressure to the spot that it needs to be. So we're going to look at some non-pharmacological options. One being diet or the other being the mind-body practices that will help with his stress levels, because he's going through quite a stressful time at the moment, which isn't going to help his blood pressure. So I'll leave that up to you. It'd be great if you watch both videos, as healthcare should encompass so much of someone's life. It should really be more than just one thing. So medicine is great and diet is great, and the mind-body stuff, exercise, all of that stuff is really great, but they're even better when you put them together. I'll leave you to it. Enjoy decision making.